All right, I have one question from me, and the rest of the questions are all from you all and our streaming audience. So, orthostatic hypertension, I hope I said that right. What is it? Is it chronic? What causes it? And the big question, can it be cured?
All right, postural hypotension is usually what we call it. So when you get up out of a chair or get out of bed quickly, your blood pressure drops. You could be walking and your blood pressure could drop, and that is what we call hypotensive postural hypotension. Now there's another form of that called POTS, postural orthostatic tachycardia, where your heart actually is fast, trying to keep up with the blood pressure that's low. Treatments are totally different. So the first thing that I think of, because it happened to me, is anemia. I was preaching one time about my experiences in Africa as a student missionary at the Torrance Seventh-day Adventist Church, and I was up there talking, and all of a sudden I couldn't see. And the next thing I knew, I was on the floor. But I bled out so much because of my Crohn's disease and not realizing it, that I had a hemoglobin of 6, and I was standing up there trying to talk. So anemia is one of the reasons for postural hypotension. Interesting, in people with true B12 deficiency, it can be a cause. Dehydration is a biggie. Most of the people that feel this way, if they go to the emergency room, they'll get a liter or two of IV fluids and they feel much better. Well, they need to drink more. That would help. And some of the reasons for dropping and not feeling well can be as simple as earwax causing vertigo. So clean the earwax out. We had one of those yesterday. We actually got a piece of cotton out of one of the ears. Diarrhea, vomiting, and use of water pills can make you have low blood pressure and make you faint. Certainly there's endocrine problems. It could be the diabetes, your sugar's too high, too low. It could be your thyroid, too high or too low. It could be Addison's disease. Your adrenal glands, your cortisol is not right. It could be a heart condition, it could be arrhythmias. You're having intermittent atrial fibrillation. That can make people drop and have low blood pressures. There can be coronary artery disease. There can be cardiomyopathy where the pump is not very good. And that will make people have postural hypotension. Medications for high blood pressure, again, it could be we overdid it. Now the blood pressure is better because you changed your diet. And we need to change you off that pill that was making you faint. And depression medicine and being depressed can make you have hypotension. So that is something. Neurological problems, we see it in dementia, Parkinsonism, can have postural hypotension. And the reason for that is you've got the sympathetic and the parasympathetics, and they hold hands. When you only have the parasympathetics, your blood pressure will drop. You need the adrenaline of the sympathetics to keep everything up. So as soon as you stand out of a chair, the adrenaline should kick in, and that side of the sympathetic should tighten up, and that will tighten up your veins and arteries so that the blood pressure stays to your head. But if those aren't working right, and you have a mismatch in the parasympathetic sympathetics, that can cause postural hypotension. Laying down for long periods of time, if you've been bedridden, that can make postural hypotension. And making sure that it's not a medicine, and that's usually the thing I will look for. That and inner ears are the easy things to fix in the office. Look for the medicines. It's just too much medicine. Let's just not take that one and watch what your blood pressure does. Now here's what may happen. What happens is your blood pressure gets low, and when you get to the doctor's office saying, I feel awful, your blood pressure is actually high, and that's called a rebound phenomena because your body's trying to compensate for that very low blood pressure. So what the doctor needs to do is, back off and make sure there was not a low, then a high, and make sure you're not rebounding. And you need the nice smooth level of that. So.
All right, question from the congregation. Citrus bergamot.
Bergamot, yes.
Okay, a fruit that's grown in southern Italy and touted as having the ability to lower cholesterol. Is that unique to bergamot, if it's true? Do all citrus fruits help with lowering cholesterol?
Well, let's talk about bergamot first. It looks like a lime. It's the size of an orange. And it really has lots of healthy ingredients, just like other citrus fruits. Now, again, I got a lot of my patients who won't eat a citrus fruit because they said, oh, it's too acid on my stomach. But again, if you change your diet to the alkaline diet, all of a sudden the acid foods like tomatoes and like citrus will no longer be intolerant to you. I find it all the time. Anyway, there is vitamin A, B1, B2, vitamin C, antioxidants, potassium in bergamot, and there is in citrus fruits as well. The problem with bergamot, you can't eat it fresh. It's got to come in some processed form. They found in a study of 2015, and I thought this was interesting, that bergamot was toxic to the individual, but here's why. This gentleman was drinking 4 liters of Earl Grey tea every day for 5 weeks. And Earl Grey tea contains bergamot extract oil. And this large quantity acted like a potassium channel blocker. So of course, the doctors told him, don't do that. And of course, we have tried to tell you to avoid teas anyway. In a study in endocrine, metabolic, and immune disorders, they did 60 people with diabetes type 2 and hyperlipidemia, high cholesterol. And they took supplements, and then they had a placebo. And the people that had the supplements actually showed considerable reduction in their fasting plasma glucose and serum LDL, the lousy density lipoprotein, cholesterol. Their triglycerides were down, and it increased their HDL, which is unusual. So it was helpful, but other citrus fruits will do very similarly. So yes, you should have some citrus. My patients that have medicine that they said, oh, you can't have your grapefruit because it interacts with your medicine. Well, what it does is make the medicine not be expelled as quickly from your body. So it makes the level higher. So you could become toxic from having the grapefruit. So I'm thinking most of my patients that I'm watching for like Coumadin or something like that, warfarin, if they'll have their grapefruit at the opposite end of the day, they'll probably get away with that and not have the side effects for their medicine. But if you're one of those rare ones that the doctor says don't put them together, don't put them together.
All right, I'm going to mix it up a bit, Dr. Bailey. All right. A 62-year-old male doesn't live in this community. A 62-year-old male had a diagnosis of a cancerous tumor on his colon. The doctor later found that there was spots or a spot on his lungs and liver. Is it too late to do natural methods?
He can do natural methods with the treatments that the doctor prescribes. By itself, yes, it's too late. You already have stage 4 metastatic colon cancer. And I'm sorry to say that. So here's the rule of thumb. 1/3 of all cancers worldwide is colon cancer. In the United States, 18% of the population have a polyp that's going to be cancerous or colon cancer right now as you sit here. 18%. So get those colonoscopies. It's really, really needed, and you don't like it, but it really can save lives.
So what diet should they be eating so that
Well,
they
here's the
don't
thing. Red meat increases the risk of colon cancer. Small amounts of cold cuts, bacon, sausage, and hot dogs increase colon cancer risk. The nitrites that are added to processed food then really damage the lining to the gut. Being overweight, smoking, 2 glasses of alcohol a day, because alcohol converts into acetaldehyde, and that's a potent carcinogen. And alcohol is a solvent, which then makes it easier for the carcinogens to penetrate the cell lining to the colon, and this then can affect the DNA repair of your gut and can cause free radicals and the cancer. Now, I say, okay, you don't have that diet. I have several patients that are vegan that have colon cancer. Now, how does that happen? Well, it happens because of genetics, can't pick your parents, and both of the ones that I'm thinking of had very low vitamin D levels, like single digit.
And this is this gentleman. He works night shift, has done night shift for 30 years.
And I need vitamin D level to be 50 to 80 to be protective, so your T cells attack and are protective for your immune system. We saw this with coronavirus. The T cells were off because people weren't getting vitamin D in New York, as that's where it started to show so much death. Because their T cells weren't working and they weren't able to fight off the virus, and the virus was nasty, and they didn't have zinc because they always went out to eat, and they died. So it was not good. So the 5-year survival rate for the cancer you're describing, if it's localized, it's 91%. If it's regional, it's 72%. If it's distant, which is what you have, stage 4, the survival in 5 years is only 13%, even with chemotherapy.
Yeah, the doctor advised him 3 years.
Well, that's the 3
That's
years
about right.
is better than most.
Yeah. But it's the quality of life.
Yes.
All right, another question from the congregation. If your right atrium of the heart is enlarged, what is going on that caused that enlargement? And is there anything you can do about it?
Obviously, somebody just got an echocardiogram. So my first response is talk to your doctor about this, because there can be lots of reasons. But since we're going to go back to basics and what you'd be told in medical school, this is what I will tell you. So congenital heart disease can make enlarged heart of the right side. The heart valves are not working, particularly on the right side, so severe tricuspid regurgitation. We can now go up through the leg and do a clip on that valve to pull it tighter so it leaks less, and that's kind of cool without opening your chest. We have a disease called cor pulmonale, weakness of the right ventricle due to problems with the lungs, and that's basically causes right heart failure. There's supraventricular tachycardia, where the heart goes too fast, so an arrhythmia can cause that atrium to be enlarged. Right ventricular hypertrophy is also part of this, so that the right side is supposed to be a volume pump. The pressures are supposed to be very low, like 25. Your blood pressure outside, it'd be 120 on the pressure side. But the volume side, the right side, is supposed to be 25. But in this case, it can be very high, 50, 60, 70 millimeters of mercury. And that makes it very hard for the body to return the blood back up to the lungs to get oxygen, get rid of the poisons, and then go back around and be pumped by the left heart, which is the pressure pump, and that pressures it all around to the heart and sends it all the way around. So when the right heart isn't getting the blood, then you can feel like you're suffocating, like you can get fluid collection, you get heart failure symptoms, and we need to get to the bottom of that. Why is that? So atrial fibrillation, where there's this disorganized rhythm, that can cause this. Atrial flutter, where there's a rate of 300 beats a minute, where the top goes too fast, and COPD. So what are the treatments? Well, there's medication, there's the change how you live, maybe now's the time, and medical procedures we can do, as they say, the clip, the caths, and...
This is a question. Now, so when you said change how you live, in concrete terms, what are the changes?
Daniel, fast food.
Okay.
So get back to the basics. I need Garden of Eden food. I need no processed foods. As I've said, 1 to 2 people, the United States, most people eat 1 to 2 meals a day at fast food restaurants. And that's processed food, ultra processed food, really tough on the body. It's got all that vegetable oil in it, which is a pro-inflammatory, causing cancer, increase the risk of cancer. So yes, and then they can do surgeries to do some benefit for an enlarged right heart and right ventricular hypertrophy.
Can it be stress related?
Can it be stress related? No, probably not.
Okay.
There's got to be something structurally more going on. I would figure the atrial fib is the most common one we see. That's intermittent maybe. You go to the doctor and you're in rhythm, but you go in and out maybe at night because of your sleep apnea. So if we can get those fixed, then it will markedly improve the pressures in your lungs.
All right, and maybe this is kind of related. If your pulmonary artery is under pressure, and that artery again is slightly larger than it should be and affecting breathing, what's going on? Is it all related?
It's all related.
All right.
I would figure there's an arrhythmia. That's the first thing I would look for. And sleep apnea. I'd get a sleep study. That's what I do first.
Okay, melatonin. Okay, and this will probably be our last question. Melatonin. There is talk going around, I don't know if you've heard it, that melatonin is bad for you. Your body makes melatonin, and this one that we take as a supplement is bad for you. Is it?
It can be, sure. So some of the side effects can be melatonin can cause depression, mild tremor, anxiety, abdominal cramps, constipation, diarrhea, irritability, reduced alertness. Of course, they ask you not to drive any heavy machinery for 4 to 6 hours after you've taken melatonin. Confusion, disorientation, daytime drowsiness, vivid dreams or nightmares, decreased appetite, urinary incontinence, risk of falls, can provoke a seizure, can do mood swings. So, we oftentimes will give melatonin versus a drug to sleep because your melatonin levels are usually highest at night, and it helps because that helps then get into the sleep cycle. We will also use melatonin short periods of time for jet lag. Works very well for that. I oftentimes will recommend my patients to try 10 milligrams of melatonin. You can cut it down if it's too much. And if that doesn't work, I would add B12 or B complex, to it, separate supplement. If that doesn't work, you need to talk to your doctor. So there's something else going on physiologically, and again, it could be snoring or something like that, so waking you up in the cycle. You could have your days and nights mixed up, things like that. You want to be sleepy during the day instead of at night, and that needs to be cared for. So the melatonin can affect those on blood thinner because it can affect your clotting. It can affect if you're on seizure medicine. It can affect on birth control. I've seen people on melatonin and birth control get pregnant. It can affect your high blood pressure, effectiveness of your high blood pressure medicine, your effectiveness of diabetes medicine, and it can certainly affect your immune system if you're on immunosuppressants. And it's broken down in the liver, so anything that's metabolized in the liver will compete with that, and that's why those things can be an issue. So moderation in all things. If that works for you and you have no side effects, okay. But if you're having difficulty with it, stop it.
Now, so here's the second part to that question. Do we produce less melatonin as we age? And if that's the case, is it okay for older people who struggle sleeping to take a little melatonin each night?
Yes, and yes.
And what's classed as a little? What's the dose?
5 to 10 milligrams.
Okay.
You're going to find that the 3 milligram probably doesn't work. If it does, great.
Okay. Thank you, Dr. Bailey.